Hi, my name is Daniel Dudenkopf, and I am an internal medicine resident at the Mayo Clinic in Rochester, Minnesota. I am pleased to present our original article titled Changing Incidence of Serum 25-Hydroxyvitamin D Values Above 50 nanograms per milliliter, a 10-year population-based study. This article will be published in the May issue of the Mayo Clinic Proceedings. Vitamin D supplementation, both over-the-counter and physician-prescribed, has increased dramatically over the last few decades. Because of this, we aimed to look at the incidence of vitamin D levels above 50 and at vitamin D toxicity. The cutoff of 50 was used because this value was chosen as the safe upper limit of normal by the 2011 Institute of Medicine Committee. They made their recommendation based on a thorough review of the literature of several studies that suggest an association between vitamin D levels above 50 and long-term adverse events such as falls, fractures, cardiovascular events, certain cancers, and all-cause mortality. We performed our study by retrieving the records of all patients in Olmsted County, Minnesota, who had a vitamin D level above 50 in the 10-year interval from 2002 to 2011. Our results showed that there was a 26-fold increase in the incidence of vitamin D levels above 50 in this time interval. This is an increase from 9 to 233 cases per 100,000 person years. In our analysis, there was no association between vitamin D levels and serum calcium levels, nor between increasing vitamin D levels and the risk of hypercalcemia, even at very high vitamin D levels of over 100 and even at 200. In a medical record review, we only identified one case of true acute vitamin D toxicity in a 51-year-old woman who presented with severe hypercalcemia with clinical signs and symptoms. The encouraging aspect of these results is that acute vitamin D toxicity is indeed rare, and it is a very unlikely outcome, even at very high serum vitamin D values, as high as 100 and even 200. However, the dramatic rise in the incidence of vitamin D levels above 50 is concerning given the association between such levels and long-term adverse events. Thus, we recommend that physicians monitor the vitamin D levels in patients who are on prolonged courses of vitamin D, especially at high doses. Furthermore, we encourage greater awareness by physicians and patients of the over-the-counter vitamin D supplements that they are using and their doses. Finally, further studies are needed to better characterize the association between vitamin D levels above 50 and long-term adverse events. We hope you get a chance to read the article in the Mayo Clinic Proceedings. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.